New question, the member from Toronto Danforth.
Thank you, Speaker. Speaker, my question to the Minister of Health. For the fourth year in a row, I rise to ask the Minister of Health for an investigation into the substandard care of Dimitra Daskalos, who passed away in a Toronto hospital in February of 2011. The family of Mrs. Daskalos is still waiting answers, and this government has failed to provide them. The daughter of Dimitra, Maria Daskalos, is here with us today. I've sent numerous letters to your predecessor, asked questions in the House, made statements and presented a petition with over 5,400 signatures. I sent this minister a letter last February 2015. The family still doesn't have answers to the questions that it asked. Mrs. Daskalos was treated as a bed blocker, and the hospital was clearly in violation of infection control guidelines when she was housed with other patients with an antibiotic-resistant disease. Will the minister commit to investigation of this case?
Thank you. Minister.
Well, thank you, and I appreciate the question, and I want to acknowledge you here. I'm going to speaking to you directly. Acknowledge your presence here today, and my regret that the experience that did happen
Chair, please.
To you, and I can only imagine the devastation, the devastation that it has caused, Mr. Speaker, to the family and loved ones of this individual. And I would be happy to discuss as well afterwards the specifics of this case. And in the supplementary, I think that I would like to also talk about changes that we put in place that hopefully will provide avenues for individuals and families that do go through these tragic circumstances.
Thank you. Supplementary.
Thank you, Speaker. Speaker, I just want to note as well that it was almost a year ago that this government decided not to give the Ombudsman power to investigate these kinds of cases. Once again, I ask this minister to launch an investigation into the substandard care of Dimitra Daskalos, received while a patient at the downtown hospital, and her subsequent death apparently due to the hospital's failure to comply with infection control protocols. Although hospitals are independent corporations directly responsible for the quality of care they provide, the legal accountability and enforcement of breaches in hospital protocol rests squarely with the Minister of Health and Long-Term Care. Minister, why were infection control guidelines violated?
Minister.
Well, thank you, Mr. Speaker, and I'm very proud that what we have done as a government is we've created the Office of the Patient Ombudsman, specifically for cases like this where individuals or family members, where an incident occurs, perhaps in a hospital environment or a long-term care home, if they're unsatisfied with the process that takes place in the hospital, if they don't receive remedy for what they see as a grievance against them, they now have, very shortly, will have an avenue that they can go to a patient ombudsman within the Ministry of Health, or rather the reports directly to the Minister of Health within Health Quality Ontario, which will work to address their concerns. We do have a responsibility as a government, Mr. Speaker, to make sure that our patients, Ontarians, are provided with the highest quality of care when incidents do occur, when mistakes are made, when procedures aren't followed correctly. We have an obligation to make sure that action is taken. That's the commitment that we have, and our patient ombudsman will help us through that process, Mr. Speaker.
Thank you.